All right, everybody. Well, we are now on insurance, specifically health and disability insurance. So we're going to cover health, disability, and we're also going to look at federal programs such as Social Security and long-term care. So we're going to kind of hit the gamut of these different insurance, and they're very important. Hopefully, you'll find that as you go through this set of slides. One, that there's a ton of information in here, and two, health insurance, especially in our the ages that we are, you are more likely to get sick or disabled than die at our age. Obviously, as you get older, that starts to to transition. Although old people do get sick a lot. So it's going to be very important that we understand health and disability insurance, specifically health insurance for many of us. Now, fortunately, many of you are probably still on your parents' health insurance, which obviously is a huge benefit. However, at some point, you are going to transition to probably your employer's plan. So at least you'll be able to have some context as it relates to what types of questions to be asking when you get to that point. All right, so let's go ahead and get started. All right, so basically, what is health insurance? Okay, there's a couple of it's pretty basic, right? So health insurance is nothing more than paying a premium and transferring the risk of financial loss due to health related issues. Okay. So remember, when we think about risk, we're thinking about the potential loss. And in this case, I get sick and I lose the ability to work. Okay. And obviously generate an income. And there are two main sources of insurance. It's going to be through private insurance companies or our government. Okay, and we'll obviously get into that toward the end of the coverage. And again, it is designed to cover the issues that are related to our health. Okay, and that can be both preventative. It can also be, if we have an issue of getting whatever issue it is, maybe a surgery that's required to get our bodies fixed to be, again, functioning in society. As we think about health insurance, there's just basic questions and thoughts that we should be considering. One is we need to make sure we understand the costs. And there's more than just, well, what do I have to pay in premiums? We'll actually get to what that means momentarily. But there's a lot of different costs when it comes to insurance. And we need to make sure we understand all of those costs, both not only specifically what the costs are, but in general terms, what am I expected to be paying? Even if I have to transition to a different plan, the cost might be a little bit different, but you should be comfortable knowing what the expected costs are going to be. And because of that, we want to make sure we're choosing the right plan. Again, we're going to get into several different types of plans, and all of them are different. They provide different features and benefits. Okay. And then we also want to make sure that when we get into a plan, we're choosing the right coverage. Okay. Sometimes we can buy insurance on our own. Sometimes we can get it through our employer. And now you can actually go to different exchanges and buy health insurance on your own. Okay. So you don't have to have it through your employer because there are some employers, specifically small companies, that don't actually offer health insurance. So there are health networks and exchanges out there in which you can buy coverage. Here's a video. You should be able to click on the PDF inside this set of slides and be able to get to that video. It's just a general video that just kind of talks through health insurance. So that way you have that at your available. All right, private health insurance. Private health insurance is going to be something that you are going to pay for that is not a government program. Okay, and it is available through an employer. It can also be available through the insurance marketplace, which again, I have that right here. And that was established through the Affordable Care Act. We'll actually talk a little bit about that momentarily. Now, when you are starting out, you have to enroll in the healthcare plan. And in some cases, if you're starting with your employer, most of the time there needs to be a qualifying event that allows you to enroll. So one, you start working, right? So that would be a qualifying event. Two, the companies typically open windows of time for you to enroll for the following plan year. In many cases, that's around the October timeframe. So most companies will say in the month of October, you can enroll in our health insurance that will start in January of the following year. sometimes you may have where a spouse lost a job or left a job, and other qualifying events would allow you to then enroll. All right. So let's talk about some. We're going to talk about three different types of private health insurance. This is the first one. It's referred to here as the fee for service. It's also sometimes referred to as an indemnity plan. Okay, so you are going to be making yourself whole basically through this type of plan because what it does is it offers reimbursements. Okay, so you pay a premium for this is again private health insurance, a fee for service. You're going to enroll and you're going to pay a premium. Okay, and as you start to have health issues, you would then submit reimbursements. There's going to be some paperwork that's going to be provided, and then you would get some sort of reimbursement. Okay. Now, what's attractive about this, the advantage is that you can choose your own provider. You can typically go to whoever you want. Okay. And because of that, you have control over your healthcare decisions. Okay. The flip side, right? Control obviously now comes at a cost, and that cost is higher premiums, sometimes higher coinsurance, and sometimes you have to get pre-approvals. Okay. Pre-approval. All right. So we actually don't see a ton of these in at least in my experience as a financial advisor. I don't see a lot of specific fee for service or indemnity plans. Again, because they are so expensive, and as premiums have continued to rise over the years, these have almost become cost prohibitive. Okay. Now, you can then transition into a different type of plan, which would be a managed healthcare plan. Okay. And this is typically going to be established in one of two ways. So the first one right here is a health maintenance order organization. We often refer to it as an HMO. Okay. And an HMO typically requires you, as the member of this HMO, to have a primary care physician. And that primary care physician is like your quarterback. Okay. So they're going to evaluate you, and then they will refer you to a specialist if it is necessary. Okay. So they will refer you if it is necessary. Okay. As necessary. Now, what this does is it's intended to keep costs down because in many cases, your primary care physician can do a lot of your healthcare in their office, right? So maybe it's just the flu, or maybe you just need a basic, maybe stitch or two. A lot of those things can be done by your primary care physician. And if they can't do it, then they actually refer it out. Okay, so you have a quarterback, and then you have all the different people on your team. That's a health maintenance organization. On the flip side, you have a preferred provider organization. And this is where a individual will select a healthcare provider, and that healthcare provider then connects to the insurance company. Okay. And they're a referral from a doctor. All right. So let's just kind of go through these again in terms of the advantages and the disadvantages of both, broadly speaking, managed healthcare plans. So the managed healthcare plans are going to be HMOs and PPOs, or preferred providers. Okay. So HMOs and PPOs, they're managed healthcare plans. They typically offer lower premiums and simplified billing. Okay. And then the other thing is that they are typically the insurance company is going to negotiate lower prices for providers that are in somehow connected to the insurance plan. Okay. So let me kind of think about this. An HMO, there's this big plan. Okay. This is their big organization. And you have your primary care physician in the middle. And then you have all of these people that could be referred within this maintenance organization. Okay. But it all starts with the PCP. In a PPO, you have basically the insurance company who attaches themselves to each doctor. Okay. And this is what I'm talking about. You can go see, let's say this right here is your doctor. You can go see that individual as long as they are partnered with the insurance company. Okay. So as long as they take your insurance, on a PPO, you will be able to go see them. Now, in the HMO, if the PCP is not your primary care physician, and your doctor specifically is not networked with that insurance program, you have to select someone else. You have to go and find someone else who is going to be part of that network, because all of these people have kind of agreed to certain ways of doing healthcare, and they do that in order to help keep costs down. Okay. Obviously, some of the disadvantages of any type of managed healthcare is it's going to provide restrictions on providers. Even your doctor may not be networked with the insurance company. Now, it doesn't mean that they couldn't, but in some cases they won't. Okay. So just want to be aware of some of these nuanced pieces. All right. Here's a nice little chart, just kind of breaking it up right here. Okay, where it talks about the indemnity plan. Remember, this is the fee for service. Okay, premiums are going to be high, but you have the most flexibility with which to select your doctor. Managed care, the HMOs, we're focused exclusively on the health maintenance organization here. Relatively low, but you do have a primary care physician. This is your PCP, primary care physician, and you have to go to them regardless of if you know you need surgery. You have to go to your PCP first, and they have to review you and then refer you. You can't bypass that product, that structure. Okay, PPOs low, can be a little bit higher because again, you can select your doctor. Okay, but again, more and more doctors are choosing to be insured or part of that PPO network. Okay, so some things to be considering when you're asking about health insurance. Now, keep in mind that when most people are looking at health insurance through their employer, right? Most people, if your employer offers health insurance, that should be a good place to start. And why? Many employers offer they are paying a portion of the fee for you to have this insurance. Okay. However, they may offer an HMO option, they may offer a PPO option. Okay. And if they do that, you want to make sure you look at what are the different costs associated with that. Making sure you understand HMO, you have to have that PCP, that primary care physician. A PPO, you get to select, but the premiums might be a little bit higher. You want to look at different deductibles and co-payments and co-insurance. Again, most of those are going to be fairly the same, but they may be different. You want to check with your doctor. Ask them, who do you accept in terms of insurance? Okay. Now, if your company that you work for, you need to make a decision. If my doctor's not covered by the insurance plan that my company uses, but they're going to pay a portion of my premiums, I may consider switching a new doctor. You may not want to switch doctors, and therefore you may need to decide to go to a different healthcare option besides your employer. Okay. So again, there's just a lot of things to consider here. So what's included in the policy itself? Well, obviously it's going to include the names of all of the individuals insured, where they're located, and they're going to talk about specifically what types of renewing policies the plan is going to enable. So in most cases, when you're with an employer, it's going to be as long as you're employed and you're making your premium payments, which one of the benefits of employer plans is the automatic premium payment. Well, what do I mean by that? Well, in many cases, your employer will automatically remove that from your gross pay. So you don't even see it. You don't have to write a check at the end of every month. It is automatically removed from your paycheck. So it's like an automatically covered expense. So as long as you're employed, you would have that as an option. Okay. And it's also going to talk about different things such as maybe exclusions. There may be certain things like pregnancies, mental health, occupational therapy, chiropractic. All of those different components are going to be outlined in the details of the policy. Okay. So that's, again, very, very high level overview when it comes to healthcare plans. So just as a recap, we have fee for service, indemnity plans, we have HMOs, and we have PPOs. Okay. All of those are going to be a little bit different in terms of where you get them, through your employer or through a private health insurance network. And you want to make sure you're evaluating all of those in terms of the costs, the coinsurance, all of those things. Okay. Many employers also add dental and vision because those are not part of your primary health care. These are actually separate insurance coverages. Again, dental would be, things like oral exams, x-rays. Sometimes you have to have surgery with crowns or teeth coming out. And then in some cases, orthodontia, right? So this is going to be your braces. Vision typically is an insurance that's going to help cover for your biannual exam, eye exam. Sometimes it'll actually also help give you discounts on glasses and frames and contacts. Okay. Okay. Again, let's talk a little bit about what are some things that you are going to have to pay for. Okay. So this is very important when it comes to insurance. The first is you have a premium. Okay. So the premium is going to be what you pay on a regular basis just to have the coverage. Okay. And this is going to be an out-of-pocket expense in some cases. Some cases it can be deductible, but just keep in mind that you have to pay this on a regular basis. Okay, so that's the premium. Then you have coinsurance. Coinsurance typically runs something like 80, 20, or 90, 10. All right. What that means is once you have, well, actually, you know what? Let me go back here to this. So we have a premium. We also have a deductible, and that is the initial amount you must pay out of pocket before your insurance even starts to pay anything. So if you have a $1,000 deductible, so you're paying your premiums, and you have a health incident, and you go to the doctor, and let's say they draw blood and they do some scans and tests, and there's $1,000 or $800 worth of medical procedures that are done. Okay, and that's what you owe. You get a bill for $800. A deductible is what you are responsible for. So if you have $1,000 deductible, then that means that until that first $1,000 of all of your medical expenses are paid for the year reaches $1,000, you must pay the full $1,000. So the higher your deductible, the lower your premium will be, and the lower your deductible, the higher your premium will be. Okay. So once you pay your deductible, so let's say you get a $1,500 bill, you will be responsible for the first $1,000. So you'll pay that, and then you'll owe $500 left. Okay. So let's say we get a $1,500 bill. Okay. I pay my $1,000. This is my deductible. Okay. Now I have $500 left. Okay. Now we move over to what's called coinsurance. And let's say we're in 90-10. Okay. So what does 90-10 mean? Well, 90% of what's left is going to be paid by the employer, and 10% is the employee. That's you. Okay. And you are responsible for 10% of this remaining amount, which in this case would be $50. And your employer will pay $450. So you paid $1,000 for your deductible, and then you paid another $50 if you were in a 90-10 coinsurance split. All right. And then there is going to be a maximum out of pocket. So let's say your coverage has, let's say $5,000 maximum out of pocket amount. So let's say you're at a huge accident and it was costing, let's say, hundreds of thousands of dollars. You will pay your deductible. You will pay your coinsurance premium up to whatever that maximum amount of out of pocket, which in this case would be $4,000 of coinsurance. And that's because you had $1,000 deductible. So your total out of pocket would be $5,000. Okay. And then you also need to make sure you understand the difference between network, in-network, and out-of-network. In-network services are typically going to be people who have said, yes, I'm willing to accept, and we've negotiated with the insurance company these specific rates. So the doctor's saying, yes, we've negotiated, these are specific rates that I'm going to get reimbursed by the insurance company. Those are in-network physicians or medical providers. Out-of-network does not have an agreement with the with the insurance company, and therefore typically the out of network costs are going to be much, much, much higher. So it is really incumbent upon you to ensure you're trying to get in-network doctors to perform their services. Now, in some cases, obviously that is uncontrollable, but maybe you work with your insurance company if that comes to be the case. Okay, let's just make sure we reiterate some of these key terms. Okay, so the premium, it's going to be your monthly kind of fee just to be a part of the insurance group. Okay, the copay, this is typically a fixed amount of what you must pay a doctor every time you go. And it's typically pretty small, $10, $15, some cases 50, depending. The deductible, this is the amount you have to pay out of pocket before the insurance company does anything. So if it's $1,000, you're going to be responsible for $1,000. This is important because if you set aside, remember, the higher the deductible, the lower your monthly premium is. Let's say you set a deductible at $2,000. You want to make sure that you have $2,000 ready to be used for your healthcare in an instance where there's, you have an accident. You don't want to say my deductible is $2,000 and I don't have any money set aside, because you are responsible for that deductible amount. And then finally, you want to make sure you are covering yourself, remember, to that max out of pocket value. Maybe that's 5,000 or 6,000. Typically, that's kind of the range for traditional major medical insurance carriers. If you're in a high deductible, it might be 8,000 to 10,000, but you also have an opportunity for health savings accounts and flexible spending accounts. But you need to make sure you're aware that you are responsible for the premium, the copay, the deductible, and co-insurance. So if you get into a big accident, it can add up. So you just want to make sure you're aware of what those responsibilities are. Now, there are some things that are not covered in insurance. Okay, so you want to make sure that you are aware, right? So what are, right? Your premiums obviously are not covered. Your deductible obviously is nothing that you still have to pay for. You have to cover these things, so you must budget for those. Okay, very important. How can you do that? Well, here are two options that you can use to help pay for those expenses. Okay, flexible spending account. The key here is that funds cannot roll over into the next year. So your employer puts money into this account, and then you can use it to pay certain medical expenses. But it is a use it or lose it. Okay. Now, with that, obviously comes a health savings account. This is actually going to be this can be relocated. And what I mean by that is this is yours. You can take your health savings account. If you move employers, you can still keep that health savings account. Okay. If you move employers and you have a flexible spending account, it stays with the employer. Okay. So it stays there. It's not going anywhere. You would lose and give up any money that's in that flexible spending account. So health savings accounts can be very valuable. Okay. It's also something that you can use and take with you to pay for medical expenses. Okay. And they are associated with high deductible health plans. Remember, high deductible, lower the premiums. So if I can increase my deductible, let's say to $5,000, but I can put money over here into my health savings account that'll cover that $5,000 if I need it, then I'm kind of offsetting myself, but my premiums are going to be much lower, or can be lower. Okay. All right. Sampling of what flexible spending accounts can and cannot be used for. So focus on this slide on these two pieces right here. So what can it be used for, right? So I have this debit card. That's basically what it is. And I can do things like prescription medications, doctor visit copays. Here's the other thing. Over-the-counter health products like Tylenol, aspirin. Yes, those are good. Okay. I cannot use it, though, for supplements, cosmetic procedures, non-medical items. And of course, I can't pay my premiums with my FSA or HSA. Okay. Again, here's another. We're moving into government. So I'm going to take just a pause. That is health insurance, private, dental, and vision. Okay. And we talked a little bit about different types of ways that you can cover high deductible expenses through flexible spending accounts and health savings accounts. All right. So now we're going to transition into a little bit on the government healthcare plan. Now, most of the time, the primary focus on government insurance plans is on Medicare. Medicare is going to be for those over the age of 65. Okay. At 65, you must enroll in Medicare. Okay. So I would encourage you to go to Medicare.gov if you want to look at see what types of information is going to be available to you. Of course, government website, it will be a lot of information. There are four main parts to Medicare. Part A is going to be inpatient care, specifically things for like hospitals and nursing facilities. So your coverage for Part A is going to be inpatient, hospitals, nursing facilities, meaning you are staying inside of one of those facilities. Okay, that's Part A. Part B is going to be outpatient care, physical therapy, home health. Okay, inpatient in a hospital or nursing facility, that coverage, that Part A coverage, whatever those amounts are going to be, is what will cover those services. Part B coverage covers outpatient care. Okay, very important. Part C is going to be not necessary, but it's actually going to be through private insurance companies combining A and B. So, for example, you might go to a health broker or an insurance broker and say, I'm looking for Medicare plans, and I would like to look at Part C, which will combine these two together. Okay, so these two together is C. And then finally, we have Part D, which is for your prescription drugs. Okay, A, inpatient, B, outpatient, C is private insurance that covers both, and D is your prescriptions. Okay, now those plans are obviously not free, and as an elderly person, as you're getting older, you might be on a fixed income, you might be low income, and so there is opportunities where those expenses can get to be a lot of your monthly budget. So there are Medigap plans. Okay, Medigap is also known as basically a supplement to Medicare, and it's provided through private insurance companies. So it's provided through private insurance companies to cover medical expenses not covered by Medicare. Okay, so there are going to be certain things that Medicare will not provide or pay for, and so these Medigap plans are going to be supplements that will help ease some of the costs. I'll just give you maybe a quick example. Again, I don't know if this is actually a covered expense, but as people age, they may need orthotics, special shoes for your feet to help keep your body in balance. Okay, and that may not be something that Medicare pays for. Medigap, on the other hand, if you have a Medigap policy, it might actually cover for, or at least a reduction in those shoes, because maybe those shoes might be $400. Medigap might pay 350 of those, so you might be only out $50. Okay, all right. So what are some options? Well, there's the standard Medigap policies to choose from, and that's basically A through N. A is going to be your most basic, and you kind of move through the alphabet as you add more and more coverage. All right, that's Medicare. Medicaid is really a program that's designed for typically needy families. Okay, typically low income households. Okay, it's a federal program that's going to provide healthcare that are low income, also people who are blind or disabled with dependent children. Okay, so it's going to be a program that's going to be just different than Medicare. Okay, and it is administered state by state. Every state is a little bit different. Okay, so if you have someone that's elderly, that is extremely that's either blind, disabled, or low income, you would want to go to your state and figure out what different components or fees is the Medicare going to be. Okay, now we're transitioning into COBRA. COBRA is a extension healthcare program if you leave your employer. So in other words, let's say you either get fired or you terminate your employment and you had health insurance. Well, once you remember, we talked about this. Once you leave your employer, you're no longer covered under their healthcare plan. However, people can't necessarily start another job on day one, or maybe they don't have coverage on their new job for, let's say, the first month or the first 6 months. So they can choose COBRA insurance, which allows them to maintain their previous employer's healthcare coverage, but they're going to pay the full premium. So it's going to be typically fairly expensive to do that. Okay. But obviously, if you need health coverage, that is a way to keep it. All right. So it provides protections for employees who may lose their employer sponsored health coverage. And it can go up to 18 months. After 18 months, regardless if you've already established new insurance or not, it would stop. Okay. All right. Affordable Care Act. So this was, I think, established in 2010. This is typically referred to as Obamacare. And it did basically kind of two things three main things, I guess. One, as you can see here, it allowed young adults like yourselves to stay on your parents' plan until age 26. That was really big. Okay, so now people up through graduate school could even be on their parents' insurance plan. It also established where you cannot be denied applications based on pre-existing conditions. So there were some employers who were saying, well, you have, let's say you have diabetes, okay? And you had diabetes before coming onto our plan, we're going to deny you healthcare, right? Well, they couldn't do that if it was a pre-existing condition. They would not be able to deny applicants. Also, it helped create access to healthcare insurance through the exchanges, okay? And of course, if you want more information about the Affordable Care Act, you can always go to healthcare.gov, and there's a lot of information out there about that. Legislation that is affecting healthcare. Of course, this is always going to be a big deal. Specifically when it comes to Medicare and when it comes to, we'll call it socially funded, healthcare. There's a lot of debate on whether or not it's best to keep health insurance in the hands of private insurance companies or to move it to a more state-run type of system. So like Canada has healthcare for everybody, and it is part of the taxing system, okay? So again, there are probably pros and cons to both sides, and I'll let you decide kind of what you think in terms of what might be the best option. All right. Long-term care. Again, I know we've been talking a lot about different insurance. This is just a high-level overview. And if you're finding that this is extremely exciting, this may be a career where you might move into becoming an insurance agent, helping people with their different insurance needs. Obviously, if you're a financial planner, you might be focused on insurance for your clients in a paradigm of looking at all of the different financial decisions that they need. So insurance, risk management, and investments and estate planning, those types of things. Those are the types of things that if you're excited about this type of material, this may be something that you might want to pursue. All right, moving on. Long-term care. As people age, they are going to need to transition into perhaps an ability to need healthcare, or at least daily care for sustainability. Okay, so long-term care will actually help cover the cost associated with the financial need or strain of hiring people to help you. Most of the time, in order for long-term care to be established or just to start paying out the benefits, you must not be able to perform 2 of the 6 daily activities. And here is the most common listing of 6 daily the activities of daily living. Can you feed yourself? Can you go to the bathroom? Can you bathe? Are you able to walk? Can you transfer from a bed to the floor, right? Or from a couch to walking? And can you dress yourself? Okay, if you are unable to do 2 of those things, then it's likely that you may need long-term care help. Okay, is there a need for disability? Right, so we've talked about healthcare, we've talked about dental, we've talked about vision, we've talked about the government-sponsored Medicare, which would be healthcare. We've talked about long-term care, and what about disability? What happens if you're 30 years old and maybe you get into an accident and you need to cover yourself while you're recovering, while you're rehabilitating? Okay, this is a huge need, especially for young individuals, because the likelihood of needing life insurance may not be as high as disability. Okay. So disability is going to cover you typically at around 60% of your income. And should you become disabled, this insurance coverage will kick in and typically replace about 60 to 70% of your salary. Now, you must be working in order to be eligible for disability insurance. Obviously, if you're just if you're staying at home, you don't have a job, you get hurt, well, nothing's changed for you. But if you're working and you get hurt, obviously now you potentially lost the ability to cover those expenses. Okay. Um, there are basically two types of disability. There can be short-term disability and there's long-term disability. So long-term disability might be you lost a leg or any sort of limb. Short-term disability might be you have significant surgery and you need to be out of call it out of commission for, let's say, 6 months. Okay, that's a much shorter disability. So long-term disability is going to be covering these um, uh, issues in your life where extended periods of time that you are classified as disabled. All right. Now, it's important to make sure you understand this, specifically, students, is that under people under the age of 67, this is very important. People under the age of 67 have a higher chance of becoming disabled for 90 days than dying. You have a higher chance of becoming disabled than dying. Okay. So if you think about that, what risk do you really need to transfer to an insurance company? Is it life insurance or is it a disability insurance? It's primarily a disability insurance. You are more likely to become disabled than you are to die under the age of 67. Okay. And let's talk a little bit about the disability insurance types. So obviously we mentioned that there's long-term disability insurance, okay, 2, 5, or up to age 65 or death. That's long-term. Short-term is typically going to be less than 2 years. Okay. The insurance company, the disability income insurance is typically going to be about 60% of your wages. Okay, roughly. Now, here's where I want you to make sure you really are focused on. How do you define disability? Well, there's two main definitions. There is the own occupation definition. Okay, that means, are you able to do the very specific occupation that you were doing? I'll give you an example. Let's suppose that you are an opera singer, and that's how you get paid. And you establish maybe you have throat cancer, and the cancer ultimately is removed, but it actually is no longer the ability for you to sing. Right? You cannot sing. Disability would actually cover that under an own occupation. You cannot do your occupation. You can't be an opera singer anymore. A more restrictive would be, can you do any occupation? Well, if you have an any occupation definition, then it's going to say, well, can you teach sing lessons? Can you work at a restaurant? Can you do anything of those types of things? The answer is yes. Well, then the definition of disability is no longer there. You're not disabled. You can just do something else. Okay. So again, you want to make sure that you're understanding the definition of the disability. Okay. So sources of disability income can come from obviously your own individual disability policy. There is a Social Security disability insurance for eligible workers who become disabled. Many employers will have disability coverage. And of course, if you get hurt on the job, most employers are required to have workmen's compensation coverage so that if you get hurt while on the job and you are now under the definition of being disabled, then you would be eligible potentially for workmen's compensation. But just keep in mind, it only applies if you are on the job. Okay. I've already talked a little bit about this in terms of the amounts and the coverage. So disability insurance, remember, typically will cover no more than about 60 to 70% of your salary. If not, someone may just force themselves to get disabled and say, hey, I'm gonna get 100% of my salary. So you don't get 100%. You also need to understand that their coverage will be determined based on the policy, okay? And it typically will go up to age 65, okay? And the reason typically it stops at 65 is that's also when Social Security will jump in. All right, everybody. Well, with that, I think that wraps up. I know that I went through fairly fast, but you have access to the slides. And just make sure that you're thinking through some of the things that I really highlighted, because I don't want you to think about all of the material on insurance. I mean, we have classes that cover all of the details of these types of this amount of content. We're just trying to provide you an overview. So if you walked away from this video thinking, I know the difference between a health maintenance organization and a PPO. I know that I really need to focus on maybe disability insurance coverage. I kind of have a somewhat familiarity with long-term care and maybe even the Social Security structure system. Not necessarily super needed for 21 or 22 years old, but you want to make sure you have an understanding of the different types of coverages you might be walking into as you get ready to be employed. All right, everybody. I will see you on the next one.